Good evening, everyone. It is Thursday, June 4th, and I'm going to start with the usual statistical breakdown. We currently have 593 cases total in Sonoma County. That includes 285 active, 304 recovered, and still the 4 fatalities. We have been doing a lot of testing, so we now have more than 27,700 negative tests and 593 positive tests that we have conducted within Sonoma County. Of the total positives, 551 of those cases have not required hospitalization. 42 of those have required hospitalization. I'm going to be starting to include some of the demographic information. So of the total number of cases that we've got, where we have the demographic information, 72% are Latinx, 22% are white, 3% are Asian or Pacific Islander, and then 3% are either Black, Indigenous, or other. With respect to where we are seeing those cases, 5% of those cases are in West County, 20% of those cases are in South County, 9% of those cases are in North County, 4% of those cases are in East County, and 1% of those cases is under investigation, with the remainder being in Central County. Looking at how those cases are being transmitted and received, we have 17% that are attributable to community spread. That means where we don't really know exactly what the source of the COVID-19 infection was. 65% were traced back to close contacts. 9% were affiliated with travel, and 9% remain under investigation. Now, looking at the age breakdown, 96 of those cases have been in the 0 through 17 age range. In the 18 through 49 age range, 335 positive cases. In the 50 through 64 age range, 103 positive cases. And then in the 65 and over category, we have 58, with 1 case remaining under investigation. The current breakdown with respect to gender is 48% female and 52% male. We do have some new additional information on the SoCo Emergency website. So if you go to the SoCo Emergency website and you scroll down and you click on the dashboard, that is now going to bring you up to a landing page where you can not only look at the sort of specific case data, you can also look at the roadmap to recovery to see exactly where we're tracking on the different metrics that we provided for the state to sort of know whether we could continue to move forward with reopening. So that also has real-time data with respect to what our current hospitalization rate is, which I think is really interesting to be able to track the number of ventilators, the number of hospital beds, and the number of ICU beds that we have available. So I'll share a little bit of that new information as a teaser, and if you want to learn more about that, just go to SoCo Emergency and you can pour through all of the data yourself. So we actually now have information about the cases by employment sector, which I think is really important to know, and I'm just going to read some of the top few categories. So 14% of the positive cases were found in services and sales, 14% were attributed to unemployed folks, 12% in the ag and farm worker category, 9% in healthcare, and 8% in manufacturing. And there are a lot of different categories, so you can actually go and see, what is the number of cases for each category. I also wanted to note that as of June 2nd, we have 12 total confirmed or suspected, and suspected cases in the hospital that are pertaining to COVID-19. But overall, looking at our healthcare system capacity, we have 218 hospital beds available, 12 ICU beds available, and 67 ventilators available. And I just want to remind you that, we have a couple of different forms of data up on the website. One is, what are the COVID-19 cases in the ICU, but you have to remember, of course, that we have regular ICU cases as well, and so that's why the hospital capacity is a little bit different than what the actual number of COVID-19 hospitalizations are. Now, what is the biggest news in the county? We have a lot of news coming along. Number one, we actually do finally have antibody testing available in Sonoma County. I will warn you, it is not available sort of in a mass scale suitable for the public to be able to get those tests right away. We're going to start by focusing on those higher risk categories and on folks that we also knew, did have the disease, just to make sure that, check them, check their close contacts, check healthcare workers, first responders, and others. So that is the news as of today. And then I also want to share some news that is forthcoming. So on Saturday, we will see another wave of reopening of businesses. This will include indoor dining, indoor retail, barbershops, hair salons, but I want to be clear that that's actually only for hair services. So you can't go to your hair salon and get a waxing or any other ancillary services. And that is because the state has drawn this clear line, right? They're saying, you know, barbershops and hair salons, but only for hair services, not for facials or anything else that your salon might conduct. So it's important that everyone is wearing their facial coverings when they're getting their hair done. That's also a requirement from the state and local health order. Other things that will be allowed to reopen: swimming pools, dog parks, outdoor recreation businesses, outdoor rental businesses. This would include, you know, the opportunities to rent things to go outside, whether that's a canoe or a kayak, and also charter boats. And really importantly and critically, faith-based worship services in person will be allowed. That will be under the state guidelines, so we actually can't allow more than 100 people to gather at a time. And we are encouraging folks to either look at indoor or outdoor worship services. I think that if it's indoors, it has to be at 25% of the building capacity or 100, whichever number is lower. Those are the main sort of announcements today. I think that we're all preparing for that new wave of reopening on Saturday. We can expect the next public health order to be released tomorrow, and will be released in both English and Spanish, and then to take effect, you know, at 12:01 Saturday morning. So with that, I'm going to go ahead and turn it over to questions. I'm happy to answer anything about what county government is doing. Also happy to take feedback. And if I don't know the answer, I promise I will write down the question and follow up. So I am going to scroll up and see what I can find. And I also have my helpful husband over there who can help me track questions.
Share your point of view if you support opening vacation rentals before hotels because they permit social distancing. And are you aware that some hotels are renting without asking essential lodging documents?
Great question. So this question is pertaining to would I sort of support opening vacation rentals prior to opening, say, other forms of lodging facilities? I have actually advocated all along for a risk-based approach to reopening. And so this would actually fall in line with a risk-based approach. And I certainly would support opening lower risk types of lodging before higher risk. So higher risk forms of lodging would, say, be a large hotel, you know, that has elevators and lots of common hallways that are interior. That is going to be a higher risk for transmission than, say, a vacation rental or even a B&B that actually has independent little guest cottages, right, where they have their own restroom, they have their own entrance and exit, and there isn't a lot of common space. This is also actually another example of a low risk activity would be, say, Cassini Ranch, where you can take your own RV or trailer with your own restroom and your own personal space out there and just rent the space itself and then enjoy the beautiful outdoors, which of course we are allowed to do now. Oh, by the way, I forgot to mention, everyone, I'm sure that you've already heard, but the coast is open now. And I heard just this afternoon that state parks finally removed those cement blocks from the parking lots. So the coast is open. Go out there and get your vitamin C, SEA, as Patty Ginocchio out there at Ginocchio's restaurant likes to say. But yes, I would certainly support the lodgings looking at a risk-based approach. We're really waiting for the state on this one. And we haven't, I've been asking Dr. Mace, she's been asking CDPH, I've been asking our state legislators, and no one really knows what the state is thinking with respect to those tourist-based businesses. And one of the things to recognize is that there is currently still that statewide ban on non-essential travel, although of course the definition of essential travel has been expanding over time, but that is really what is limiting the reopening of those tourism lodging facilities. I also do want to recognize that I've heard of a number of businesses in West County in particular who are now operating questionably out of compliance with the public health order, and I've heard that San Diego County actually requires paperwork. So the hotel, I think, actually has to ask every customer to fill out this paperwork to confirm that they are allowed to utilize that lodging. So that's something that I'm going to be looking into and reaching out to some of my colleagues in San Diego County. I actually heard that from my mom who lives there, and she said that that was what they're doing. So I'm gonna look into that. Next question.
Can people visit second homes not to rent, just to visit?
This is a great question. Can people visit second homes not to rent, just to visit? And I actually asked this question when I was reviewing the new public health order this morning of County Council. And County Council was not clear as to whether that was legal based on state guidelines. So our attorney, our Chief County Counsel Bruce Goldstein, actually promised to formally submit that question to the state of California to see if people are allowed to visit their second homes. And what my argument was, okay, so now we can go to the coast, and you're allowed to go and recreate at the coast and spend the day there. But if, for instance, someone who lives in Santa Rosa had a home along the coast, they wouldn't be able to spend the night. And that just seemed like a little bit of an illogical thing to me. So I asked that question, and we will be floating that to the state, and I will let you know as soon as we have an answer on that one. Next question.
Do you know how many people are currently hospitalized?
Do I know how many people are currently hospitalized? I do actually. So it was that number that I shared earlier, which was, I believe, let me check my notebook. I believe it was 12. And that's 12 either confirmed or suspected COVID-19 patients. So some of those folks might have tests still pending. They are suspected of having COVID, but they are not yet confirmed. And if you go on socoemergency.org, again, you can see that data in real time tracking the number of hospitalizations, and then also the number of available ICU beds, hospital beds, and ventilators, so that you know exactly what our healthcare capacity is at any given point in time. I will apologize, not all of the information is exactly up to the minute and up to the day on that new dashboard. And that's because our epidemiologists are currently working 14 to 16-hour days, 7 days a week. And there were a number of workplace clusters that they have been investigating. And so they try to update the data as often as they can, but I apologize that it's not all exactly updated. I am requesting that, and I know it's on their list of things to do. They actually do have to manually cull that data and then sort of upload it to the website. So next question.
Questions about particular things, massage therapy and youth sports, when will they?
Great question. So question about youth sports. So number one, one thing that is new about the again draft of the health order that I reviewed this morning is that sports and recreation are actually now allowed in groups of up to 10 people. So that is something that is actually new for the first time, is sort of allowing folks potentially from different households to come together for the purposes of recreating. And so I just wanted to throw that out there, that up to 10 people, would be allowed for youth sports. And then also the other category that youth sports can potentially fall into is the summer camp category. And that is because, it wouldn't be able to be competitive sports. So you couldn't have, say, a tournament where you had lots of different teams coming together. But if you had a youth who had a summer camp that was a baseball summer camp, and it was, following all of the different camp guidelines, which means that it's the same group of children with the same provider consistently over time, that would also be an opportunity for youth sports. And what was the other question? Massage therapy. So massage therapy is unfortunately considered a personal service that is currently not allowed by the state of California. I want to recognize that for a lot of folks who have, sort of especially spinal issues or, muscle challenges, that this also could be potentially considered, a form of medical care, and that some people are struggling without this. But massage is currently considered by the state of California to be a personal service, and so it is not currently allowed. So even if we wanted to implement that locally, we couldn't, because it's prohibited by the state order. I do believe, though, that physical therapy is still allowed. So if you're experiencing those kinds of challenges, perhaps you could get a referral from your physician. Next question.
Are all pools open, including YMCA?
Great question. So this question is, are all pools open, including the YMCA? The public health order doesn't actually control whether the pool's open, right? It only controls whether they can open. And so essentially the YMCA pool would be allowed to open as long as they follow these best management practices guidelines that we have developed in concert with the public health officer, Dr. Mace. And so they could, but they don't have to, right? We can't force anyone to open anything. We can only open the door and allow them to move forward if they want to. So I would say, if you have questions about a neighborhood pool near you, to reach out to whoever manages that pool. But the idea is that community pools, public pools, those would be available to the public, again, as long as they are following those guidelines. It might not look exactly like what you're used to. You might have people sort of more socially distanced. Maybe it's only one person able to, use the lane for laps at a time, but it is allowed going forward.
Is camping open in California, or when will it be?
So here's a great question, which is camping open in California? Oh, and one quick addition to the pools. I also can confirm that locker rooms will not be allowed, but obviously restrooms will be. So even though the pools will be open, locker rooms were considered to be too high risk in terms of having lots of people packed into a closed space, so that will not be open. But back to camping. The question was about camping in California. Unfortunately, camping in California is not currently allowed. Again, that's considered that part of that sort of tourism lodging that the governor is currently prohibiting. We've been asking a lot of questions about camping because it seems like it's a wonderful thing and an opportunity for families to get outdoors and enjoy, the outdoors in their own tent. And so hopefully that is something that might be opened up soon, but we're still waiting for the state to agree to that one.
He was asking about colleges, if they're included.
Gotcha. Question about colleges and whether they are included. So schools are not included in this public health order. We have, the sort of childcare facilities and preschools are, but not schools. And we're having a lot of really good, fruitful conversations actually with superintendents. The superintendents met with Dr. Mace recently. I've been having conversations, actually had two conversations today surrounding schools and the reopening in fall. And I want to just share with you some preliminary ideas. This is going to be extremely challenging for all of our different districts to implement, and people are currently trying to decide, are they going to go with an A-B schedule, some kind of a hybrid model? But I also think that there are opportunities for us to come together as government to really support our students as they return to school. So a couple things that I'm working on, trying to make sure that our bus routes are a little bit flexible so that as we move to socially distanced transportation for students, that we potentially have more ways of getting them to school, because they're realizing that they're going to have to almost quadruple their routes just to get kids to school, because with the new, social distancing guidelines, they can have fewer children per bus. And then another thing that I'm working on is the opportunities for outdoor education. So, classrooms obviously are a little bit challenging with respect to social distancing. We're going to have smaller class sizes, but if we have an opportunity to move some of those kids outside and potentially even offer some, school opportunities, if for instance there's a staggered schedule where, some kids are Tuesday, Thursday, and some kids are Monday, Wednesday, that we might be able to actually get them out to some of our regional parks when they're not there and give parents a little bit more of an opportunity for childcare. So had my first conversation about that today with Regional Parks Director Bert Whitaker, Superintendent of Schools, Santa Rosa City Schools, Diane Kittamura, Jen Close, and Lori Fong from their board, and Sandy from Regional Parks, and then Jamie from Land Paths. And so it was a really good conversation, and I'm crossing my fingers that we'll have some exciting programs to share with students as they return to school in the fall, that will get them out of doors and kind of wrap all that, science, math, project-based learning into the curriculum as well.
Specific question, wondering if Salmon Creek Beach is open.
Question about whether Salmon Creek Beach is open. I would assume that it is, but I cannot confirm that specifically. My understanding was that the, sort of bollards and cement blocks were removed from all of the different parking lots by state parks today. And so I believe that that the beaches are open. So they are per the public health order. So you are certainly allowed to go and enjoy the coast. And I think I mentioned this, but also charter boats will be allowed to operate, starting on Saturday, as will rental businesses. So people, who want to get into a kayak and get out there, at the Jenner Estuary, if that business chooses to reopen, they can reopen starting this weekend.
Somebody asked about summer camps. Maybe you can just remind me that's allowed.
Someone asked about summer camps as well, and just a reminder, that is allowed. That was actually allowed as of the last health order, and that is still permitted going forward. There are specific requirements for summer camp providers to be able to come into compliance, and that's essentially around, a maximum group size, maintaining the same cohort of students and the same teacher, so that you're not actually mingling those different groups of students or changing providers, which could potentially, create a higher transmission risk. Next question.
Hair salons and nails.
Question is hair salons and nails. So yes to hair salons, no to nails. So the only personal services that the state has allowing at this point in time are hair salons and barbershops. And even if your hair salon or barbershop offers other things, like whether it's eyebrow waxing or, sort of tattoo makeup or nails or anything like that, those other services are not allowed to operate. So that kind of personal services category, which the state considers to be higher risk activities, are not currently permitted at this point in time. Just hair and nails, but there's no limitation on hair to my knowledge. So you can get a haircut, you can get it dyed, crazy rainbow color, fun tie-dye, whatever you want.
Are there guidelines for hair people to follow?
Question, are there guidelines for hair people to follow? Absolutely, there are. And so the place to go here is to go to sonomaedb.org. Again, that's sonomaedb.org, and you'll go and you'll click on a link that says, I think it's Launch SoCo or SoCo Launch, and that has all of the best management practices for how to operate your business safely. So, this would include things like facial covering and, social distancing and sanitation practices. All of that information is available there. And we also actually have some link to local suppliers of, say, disinfectant. If you're having a hard time tracking down hand sanitizer, where can you get that locally in Sonoma County? So all of those resources can be found on sonomaedb.org. Next question.
What can we do as a community to support the protests of police brutality?
This is a great question. What can we do as a community to support the protests against police brutality and against racism and against anti-Blackness? I am so proud, honestly, of our community. My heart was warmed by seeing the videos that were coming out of Healdsburg with lots of folks wearing masks, all lined up in support of the Black Lives Matter movement. You can go participate in a protest. You can go sort of lift up your voice with the voices of other people who are also passionate about that. You can also donate to various causes. So there are various funds that are floating around that are legitimate on Facebook that are doing things like supporting bail money for protesters, that are also just contributing to organizations that advance the causes of racial justice, of police oversight, of better policy at a local level that is more racially just and conscious. So I would encourage you to either sort of raise up your voice and use your voice to amplify that message, or put your money where your mouth is and donate to one of the causes that will actually make change. There are a lot of opportunities right here in Sonoma County that we could actually do things to improve citizens' oversight of law enforcement, to ensure that folks have somewhere that they can file complaints that's safe, right? If they're concerned about how the police is treating them. I'm not saying that, by nature bad, but I'm saying that we all are better when we have oversight, right? I'm accountable to the voters. You guys keep me honest. You call me out if I mess up or if I'm doing something that's wrong. And, law enforcement is a very particular thing, right? Where they are given a lot of power and a lot of authority and weapons too, right? In the interest of keeping the community safe. So I really believe that we could implement policies here that will actually reduce fatalities, reduce police violence, and provide additional citizens oversight. One of those things is the Evelyn Cheatham Ordinance, which is trying to gather signatures before the pandemic actually got started. That's something that you could look into, advocating around that. I was the only sitting supervisor to endorse that measure. So the Board of Supervisors actually could choose to put that on the ballot and let people vote about it. So you could join that effort. There are also conversations happening right now with Mayor Tom Schwedhelm and Police Chief Ray Navarro around what kinds of policies they can implement on the Santa Rosa Police Department side of things. So I would say reach out to the Santa Rosa City Council, reach out to the Board of Supervisors, lift up your voice, and pull out your wallet if you can donate to any of the nonprofits and the grassroots advocacy organizations that are working on this. Thanks for asking that question. Great question.
You might have answered this already. When can we expect hotels for tourism to be able to open? Do you see it happening in June?
So another question, which is when can we expect hotels for tourism to be able to open, and do we see it happening in June? This has been radio silence from the state, unfortunately, and this is one that I keep asking and I have not yet gotten an answer to. What I'm kind of hearing coming out of the state is that maybe sort of some of the next things that we'll see, a lot of momentum around gyms. Maybe that might be the next thing that opens, but we're not hearing a ton of momentum around the tourism, hospitality, lodging. So again, if that's something that's a priority for you, reach out to your state representatives, try to get a sense of where the state is on that one. But right now, we unfortunately do not have any information about when that might reopen for business.
Have we seen any spikes since Memorial Day? And also, what happens when we have a spike from the protesting groups?
So this is a great question. Have we seen any spikes from Memorial Day? I would rather have Dr. Mace answer that question because she's the one who is trained to analyze the data, but I would say go ahead and go to socoemergency.org. You can actually, see the curve and sort of see how the cases are increasing, and sort of judge for yourself what you think that looks like and what might have been potentially triggered or not triggered by Memorial Day. With respect to the protest, I would say that it's going to be very difficult to separate any impacts of the protests from the impacts of also reopening, a lot of businesses that we just reopened a couple of weeks ago. So we kind of have a little bit of overlapping things happening. We had Memorial Day, we had protests, we had new businesses coming online. And while they were given the green light, about a week and a half ago, it took some people to actually, a few days to implement the public health order and to get their businesses open. So I think it will take a little while longer, honestly, to see the impacts because we'll actually have to go through the contact tracing sort of process in order to determine were there clusters affiliated with the protests. But I think it's really important that if we see, a spike in say a week or we see suddenly a lot of new cases, that we don't jump to conclusions until we actually have the granular data to see what that's from. Was it from a protest? Was it from a workplace cluster, right? Was it from a household cluster where you had, say a number of families living, and all sort of socializing together. So we may see some increases in cases, but let's always make sure that we take the time to see let the epidemiologists sort through all of those different cases to track them, to trace them, to do the contact investigation. And that's when we'll really get a sense of exactly where they came from.
Somebody asked about movie theaters.
Oh, interesting question. Someone asked about movie theaters. I have not heard anything about movie theaters, so that is something that I can ask about. But I do believe that movie theaters were in that category of a higher risk business, sort of those large social gatherings. And right now, the only larger gatherings that are going to be permitted are